CHF, a disorder of the heart function that makes it harder to pump blood. Common mnemonic for treatment is LMNOP, which stands for loops, diuretic, morphine, nitrates, oxygen, pressor. These are medications to consider, but they are not all needed. Just so you know, loops work by inhibiting the sodium-potassium chloride pump. You also should consider an ACE inhibitor or spironolactone. If they have an ejection fraction of less than 35%, an AICD may be needed. In an exacerbation, such as worsening of symptoms of shortness of breath and extremity swelling, order a chest x-ray and BNP or brain natriuretic peptide. When giving furosemide, aka Lasix, make sure you monitor for side effects. An easy mnemonic for this is oh dang, which means ototoxicity like hearing loss or damage, hypokalemia, dehydration, allergic reaction like angioedema, nephrotoxicity, gout, because furosemide may cause a gout flare. In an exacerbation, such as worsening of symptoms of shortness of breath and extremity swelling, order a chest x-ray and BNP or brain natriuretic. Keep in mind, some heart sounds you may hear on physical exam. S3 gallop, heard in systole. The cause is due to dilated ventricles. Meds that work best for this version of CHF are loops, ACE inhibitors, and beta blockers. S4, heard in diastole. The cause is due to stiffened ventricles. Meds that work best for this version of CHF are calcium channel blockers, ACE inhibitors, ARBS, or potassium-sparing diuretics.